Hi friends, good evening. This is Indra Cidambi, your psychiatrist from the United States of America. We are going to talk about the treatment of obsessive compulsive disorder in this video. Before we dive into this video, please subscribe and don't forget to push that bell button. All right. Now that we know what is obsession and compulsions, let's talk about how do we treat this. Once again, there is no cure, but we can fix this problem. The success rate for OCD is not that great. It's like 25 to 40% of people who do not respond to any of these treatments. That is a large percentage of people who are not benefiting from the psychotherapy and the medication, especially the hoarding behaviors, the compulsions, the obsessions of having this fear to throw away things and accumulating them, hoarding them is the compulsion. This is the hardest one to treat among all the rest of the OCDs that we spoke about. So we have psychotherapy and these pharmacotherapy. Among the psychotherapy, the combination of these two seems to be successful, right? Standalone, just the medication is not enough. Just doing a talk therapy is also not found to be that effective. So we need to combine those two. Among the talk therapy, we have cognitive behavioral therapy, which is the CBT, and the exposure and response treatment, which is called the, exposure response prevention, which is called the ERP. So exposure to whatever the fear is. So if someone is scared of getting contaminated, the germs, so you expose them to the germs, and the response to go wash their hands is being prevented, right? So you keep exposing them to the kind of the fear, the obsessive thoughts, but do not let them follow that with the compulsions. So that is the ERP treatment. Among the pharmacotherapy, research have shown that the SSRIs combined with TCAs, tricyclic antidepressants, are quite effective. But here the problem is, when you mix those two, there is a lot of side effects, and one has to be extremely careful, because it can lead to the combination of an SSRI with a tricyclic antidepressant, especially clomipramine, is a problem, because they say among the SSRIs, fluvoxetine and the clomipramine among the tricyclic antidepressants. Among the pharmacotherapy, they say that the clomipramine, which is the tricyclic antidepressant, with a combination of SSRI, which is specifically fluvoxetine, that combination works the best. But the problem is the clomipramine and fluvoxetine together might cause seizure, cardiac arrhythmias, and other serotonin kind of a syndrome. Those are the side effects from those, and they are really dangerous. So one has to monitor, but the success rate seems to be a little better. And also with OCD, unlike the depression or anxiety disorder, these medications needs to be really at a higher dose. And that's when you see any, relief within 2 to 4 weeks, and one has to stay on this medication between 12 to 24 months. Only then the remission is possible. And it is treatable, and also there are neuromodulating treatments that are available, such as transcranial magnetic stimulation, like, TMS, which are like the magnets that are being placed over the head, and then through the magnetic influence, there is a relief. And then there is also DBS, which is the deep brain stimulation. They put the electrode into the brain and do this stimulation. Apart from that, if nothing else is helping, then they use the surgery, which can be capsulotomy or the cingulotomy. So these are these surgery. They are going to like remove part of those brain. So OCD is a very difficult treatment, but if you do find people who are suffering from this and seek treatment at a very early, in the beginning stage of the disease, you can definitely try and help them. With that, there is so much hope to be able to get diagnosed and treated. Thank you so much, and I'll see you in my next video. Bye-bye.